So the three key points to be gleaned from our population-based investigation are: one, the incidence of vascular graft infection following arterial aneurysm repair in the population is low. Two, despite past controversies, there is still really no significant difference in the rates of vascular graft infection following open surgical repair compared to endovascular repair. And three, though infrequent, the seriousness of vascular graft infection remains apparent through its heightened morbidity and mortality, which may be attributed to the increasing complexity of patients who are undergoing arterial aneurysm repair in contemporary times. So hi everyone, my name is Hussam Tabaja and I am an assistant professor and a junior consultant in the Division of Public Health, Infectious Diseases, and Occupational Medicine in the Department of Medicine at Mayo Clinic, Rochester in Minnesota. At the time of this work, I was still a third-year fellow in the same department. The name of our article is Vascular Graft Infection After Aneurysm Repair, a population-based study. And this article will appear in the September 2023 issue of the Mayo Clinic Proceedings. This was a retrospective population-based investigation aimed at estimating the true incidence of vascular graft infection following arterial aneurysm repair in the population between 2010 and 2020. For this research, we extracted data using the expanded Rochester Epidemiology Project, which is a medical chart linkage system that holds records for about 1 to 1.5 million people residing in 27 counties within southern Minnesota and western Wisconsin. We used billing codes to identify our patients, and we used the 2016 Management of Aortic Graft Infection Collaboration criteria to define vascular graft infection. We restricted inclusion to only 8 counties because they had 90% or more of their patients captured in the medical chart linkage system. We included adult patients only, and we included all arterial aneurysm repairs from the ascending thoracic aorta and downwards. We were able to identify 643 patients who underwent 708 arterial repair procedures, which included 291 open surgical repairs and 417 endovascular repairs. When comparing the endovascular repair group to the open surgical repair group, we found that patients undergoing open surgical repair were younger and had fewer comorbidities compared to the endovascular repair group. However, the open surgical group people had longer operative time and greater percentage of emergency cases. Now, during a median follow-up of 4.1 years from the index repair procedure, a total of 15 vascular graft infection events occurred, and this translates to an overall 5-year incidence of 1.6% in the population. When stratified to the repair type, the incidence at 5 years was 1.4% for endovascular repair and 2% for the open surgical repair. It is important to note that we did not adjust for confounding factors, and the endovascular repair, as previously outlined, this group had higher comorbidities. So although the less invasive nature of endovascular repair may inherently decrease risk of vascular graft infection, this effect may be offset by a sicker target population. We did also detect an elevated all-cause mortality. Following the arterial aneurysm repair itself, the 5-year all-cause mortality reached 33.5%, and following the vascular graft infection, the 5-year all-cause mortality was as high as 76%, but only 2 of those mortalities were directly attributed to the vascular graft infection itself. So how does this finding relate to clinical practice? I think establishing the incidence of vascular graft infection is crucial, as it helps determine its current burden and provides essential support for further investigations aimed at evaluating potential interventions to prevent or reduce the occurrence of vascular graft infection. Furthermore, determining the incidence of vascular graft infection enables healthcare professionals to provide proper and accurate counseling to patients who are planning to undergo arterial aneurysm repair. Aside from one prior population-based investigation dating back to 2008 that looked at the incidence of vascular graft infection following abdominal aortic aneurysm, ours is the only contemporary investigation in the population. Furthermore, our study examines all arterial aneurysm repairs and not restricted to the abdominal aortic aneurysm repairs. I think for patients, our findings may offer reassurance by indicating that vascular graft infection incidence remains low, but also helps assist in setting realistic expectations for long-term outcomes, taking into account patients' specific comorbidities and age. To better determine risk factors for vascular graft infection following arterial aneurysm repair, it is imperative to conduct studies with a larger cohort of vascular graft infection. Furthermore, there is need for further research to discover the most effective diagnostic and therapeutic approaches for patients affected by vascular graft infection, which may involve exploring advanced technologies in nuclear radiography and molecular diagnostics. So thanks for listening to me, and I encourage you to go and read our article in the upcoming issue in the Mayo Clinic Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.